So out of all of this, the Global Down Syndrome Foundation was born. My parents retired very successfully from the cable TV industry, and they made a lot of money. And they didn't want their 5 kids to get it all. I was like, what? They wanted to do something. They didn't want to create a dynasty. They wanted to make sure their grandchildren all worked and worked hard. And they were like, what do I spend the money on? And I was like, I know. And Down syndrome. So we decided to create the Global Down Syndrome Foundation, the model of for-profit strategy in a nonprofit world. The culture, taking from our cable industry, we do have a kind of irreverent sense of humor, so if you can bear with me on that. Decision-making, also taken from our cable industry. Philosophy, really from an immigrant perspective. Hard work, really putting everything you have into it and learning and moving up. Attitude, no nonsense, infinitely patient with people with Down syndrome, but not suffering fools lightly. And then a virtuous cycle. Everybody who works for us should be excited. People who are benefiting should be excited, et cetera, et cetera. So the way we do it is a unique affiliate model. So we created these affiliates. It's all complicated. It is very complicated. And all of us have to work together to benefit people with Down syndrome. And there are a couple caveats. So we all get the generous donation from my parents' family foundation, Anna and John J.C. Foundation. But then we have to be self-sustaining. And we have to work together. And we have to meet all these measurables. And so we have the Global Down Syndrome Foundation doing the fundraising, development, outreach, advocacy, Cernic Institute doing the basic research, Rocky Mountain Alzheimer's Disease Center, because I mentioned that there's an Alzheimer's connection, unfortunately, on the disease spectrum. And then the C Center for Down Syndrome is the Pediatric Medical Care Clinical Research. I have to brag on that for a moment. At Children's Hospital Colorado, since November of 2010 to today, we are now the #1 pediatric medical care center for children with Down syndrome, patients with Down syndrome, 1,500 unique patients from 28 states and 10 countries and growing. It's pretty amazing. And then coming soon, this month, we're opening a pilot on an adult medical care center with Denver Health. So we've come really far. We've done all sorts of great things. I won't read all of that, but we'll get to the money.